Have you ever felt pain in front of your leg and shin bone or your tibia after exercising? Chances are you have what we call shin splints. But don't worry, this is a very common thing among athletes and physically active people, especially those engaged in running and high-impact activities. In today's episode, we're going to talk about how you can prevent this from happening to avoid pain and discomfort with shin splints, prevention and treatment, sports medicine and therapy. Hi there! Looking for something fun and healthy? Come and be in your best shape with us. Welcome to Mr. Pink and Mrs. Blue, where we go on our healthy lifestyle journey one step at a time. I am Mrs. Blue, here to give you tips on how to keep your body healthy during exercises. Before we begin, if you're new to our channel, be sure to hit the subscribe button and ring the notification bell beside it to keep you updated on how to lose weight and stay healthy. If you're ready, let's get started. To explain shin splints in a more precise and brief way, it is caused by too much stress and pressure in the tibia or in the area beside it, which can be a result of ignored stretching. Shin splints are common in runners, tennis players, military recruits, and dancers. New to working out? Yes, it's very common too, mainly because your body is still adjusting and needs more time. So take it easy, okay? Okay. So, how can we prevent shin splints? Number 1. Before working out, be sure to stretch your calves and hamstrings. Stretching can give your muscles time to adjust to what's about to happen, kind of like waking them up and prepping them for some beating. Of course, we're not beating them intentionally, it's part of the program. If you often forget about warming up your calves and hamstrings, they're going to be tight and prone to shin splints. Number 2. Gradually increase your routines. Some of us like to switch things up by making our routines harder day by day. But this isn't something that we need to do suddenly. Our bodies need to adjust properly to changes. The only way we can do that is by giving it time. Alter your activities like running, jumping, and walking little by little. Assess your body's capacity to adapt to change. For example, do high-impact routines every other day and meditate between days. Number 3. Make hip muscles stronger. Strong hips are less susceptible to shin splints. Why? Because it helps it to absorb more of the shock and pressure on the leg area while doing an exercise. You can consult your physical therapist and discuss what routines are best for you depending on your physical needs. Remember, health professionals are our partners. They will always give the best advice. Number 4. Choose soft surfaces. Hard surfaces require your bones and muscles to absorb more force. That will result to muscle fatigue and overuse. And of course, shin splints. If you're planning to start your workout routines on sidewalks or hard-surfaced parks with concrete groundings, you might want to consider searching for more friendly areas. Grass, sprung wood floors, dirt, sand, synthetic tracks, and fields are the best option that will help your body, especially your muscles and bones, to reduce shock and pressure. Enjoying this video so far? Go ahead and give this video a like, and feel free to share it with your friends who need it. Let's spread awareness regarding shin splints and help us grow our healthy community. Number 5. Maintain a healthy weight. Some exercises require jumping, like jogging high knees. And with increased weight, your muscles and bones will have a hard time in performing such exercises. Before, when I started working out, I frequently sprained my ankle because of too much force and weight. Overweight and obese people will have higher chances of acquiring shin splints. So be careful with your movements. We want to get through this journey with healthy muscles and bones. Number 6. Use comfortable shoes. Do your shoes feel weird whenever you're exercising? That may be a sign that you should replace them with a more comfortable pair that suits your workout needs. Some advise athletes to have spare shoes, because of frequent replacement, depending on their trainings. You can also consult your physician regarding this one, so you'll know what kind of shoes you must look out for. Ill-fitting and low-quality shoes increase your chances of having shin splints after sessions. Number 7. Make your foot and its arch stronger. Pick routines that will strengthen the foundation of your movements. Your foot. Weak foundation will render imbalance and bad posture. However, age, injuries, and medical conditions also impact the structure of the arch, as well as a lack of physical exercise. Start with simple steps, like picking things up from the floor using your foot while sitting. If your mom scolds you from being too lazy instead of picking it up with your hands, tell her, "This is for my arch, Mom." But don't shout at her, okay? We love mothers in this household. Set an appointment with your physical therapist to have proper guidance regarding these important matters. They might have some suggestions about your routines that are more efficient and safer for your condition. How do we treat shin splints? We have what is called the rice method. Not the actual rice that we eat, okay? It's an abbreviation that stands for rest, ice, compression, and elevation. First up, rest. After a very painful encounter during an activity, let yourself rest for a while and refrain from pursuing the same routine. Switch to low-impact activities until the pain goes away. Second, ice. Place ice packs on your shins for about 15 to 20 minutes at a time. But don't put it directly on your skin. Wrap them using a towel and carefully treat the injured area. Do this 4 to 8 times a day until you can't feel shin splints anymore. Third, compression. Reduce inflammation by wearing a calf compression sleeve around your shins. Lastly, elevation. Using a pillow or a chair, elevate your shins while you're treating it with cold compress for reduced inflammation. You can still do exercises with a shin splint, but low-impact ones like swimming and cycling. Just don't strain yourself too much. Did you learn something from today's video? If so, go ahead and share it in the comments below. We'd love to know your realizations. Learn more about injury prevention by watching our video, Be Aware of Injury Prevention, Physiotherapy and Wellness. Seeking for health inspiration? Feel free to visit and follow our Facebook page and Instagram account, Mr. Pink and Mrs. Blue, where we share motivational quotes to help people go through their fitness journey with a positive mindset. That is all for today. Again, I am Mrs. Blue. Don't forget, walk on your fitness journey one step at a time. Mr. Pink and Mrs. Blue, your health gurus, will see you in the next one. Bye!